outlined in the analysis, and the work, the suggestions that the committee staff made were really very valuable, and really appreciate that work. SB 524. What this bill is trying to address is the issue that pharmacy benefit managers have started a practice where they communicate to a patient that you must use pharmacy X or pharmacy Y, even though there may be additional pharmacies in the network, and the health insurance that that patient has would normally allow them to use any of the pharmacies within the network. And I think we all know that patients are safer and better served when they can fill their prescriptions with the pharmacist, if they have a relationship with the pharmacy or pharmacist that they trust, that knows their medical history, that makes speak their language or understand cultural sensitivities, that they should have the option to do so, especially if that pharmacy is within the network. However, as I indicated, sometimes they are given information by a pharmacy benefit manager that tells them that they must use a particular pharmacy or pay out of pocket. So the bill will prohibit pharmacy benefit managers from requiring a patient to go to a particular pharmacy when there is no clinical reason that the patient must do so, to thereby ensure that patients have access to a preferred pharmacy, their preferred pharmacy within that insurance network. And now I'd like my witnesses, Jim Gross from the California Pharmacists Association, to be able to present, as well as Craig Pulsipher from APLA Health.
Okay. Thank you, Senator Skinner. Moderator, please bring onto the line our primary witnesses in support who are testifying, Jim Gross and Craig Pulsipher from APLA Health. Each of you have 2 minutes, total 4 minutes between the two of you. So Jim Gross, if you go over, that takes away from Craig's time. So we can go ahead and let Jim begin as soon as he's on. Jim Gross.
Yes, this is Jim Gross. We're going to let Craig go first. Thank you.
Oh, okay. The other way. So Craig, you can take Jim's time away now. Okay, Craig Pulsipher. Do we have Craig Pulsipher on the line yet?
Hello, Mr. Chair. We are looking for Craig's line right now.
Okay.
Can you hear me?
And Craig, please go ahead.
All right, please begin.
Good afternoon, Mr. Chair and members. Craig Pulsipher on behalf of APLA Health. We are an FQHC and one of the largest HIV service providers in LA County. Today, I just want to focus specifically on patient steering and how it impacts people living with HIV and other chronic conditions. First and foremost, this practice effectively destroys a really critical relationship between patients and their pharmacists. Many patients depend on this personal relationship, sometimes someone they've known for years, to provide accurate information about side effects and to help them remain adherent to their medication, which of course is absolutely critical for this population. Patient steering can also create significant privacy issues, especially for young people, people experiencing domestic violence, and those living in more rural areas. If these folks can't pick up their medication at a pharmacy of choice, and especially if they're required to use mail order, someone could find out about their medical condition and lead to discrimination, family rejection, and even violence. And it is precisely for these reasons that mail order has long been recognized to be inappropriate and even unlawful for people living with HIV. And lastly, I just want to really stress the importance of patients being able to pick up their medication at a pharmacy where they feel safe and where they know they'll be treated with respect. Not having a culturally competent provider is one of the biggest reasons that people fall out of care, especially LGBT folks and communities of color, and patients must be given the right to receive the medication from a pharmacy where they feel welcomed and respected. Thank you, and I respectfully urge your support.
Okay, thank you. Let's now move on to Jim Gross.
Thank you, Mr. Chair. Jim Gross on behalf of the California Pharmacists Association. At one point or another, most of the committee members have raised concerns about the mergers and acquisitions in the healthcare space. This bill is attempting to address a specific consequence of some of those mergers and acquisitions. As the author stated, this is addressing a practice used by pharmacy benefit managers to effectively control all of the dollars spent for prescription drug benefits that consumers have as part of their health insurance. This is being done because corporate conglomerates made up of PBMs, chain pharmacies, and health insurers can use their combined clout to steer patients and, in many instances, resulting in the denial of patient care for pharmacy services. It's really about controlling that healthcare dollar, and that is what they have been doing through a variety of mechanisms as outlined by Senator Skinner. One of the things we want to emphasize, however, is that where these PBMs and health plans want to offer a financial incentive to patients directly, then we do believe that is appropriate because you're giving patients a choice. And this is all about giving patients a choice of pharmacies. And if, in fact, the structure of the benefit is to allow or to give the patient the option to go to a different pharmacy than they've been going to, because at the counter they will financially benefit from that, they'll get a lower copay, we understand that that is appropriate and expect that the patient will, in fact, benefit from that rather than some vague offer about how that will affect premiums and the like. So we believe this bill does give the opportunity of PBMs to structure benefits in a way that will attract people to their services, but we believe that the bill is necessary to prevent the denial of services or the structuring of benefits that effectively give them only one choice. With that, we ask for your vote, and I'm available to answer any questions.
Thank you so very much. We'll now move on to additional witnesses in support of SB 524. Name, organization, position only. Begin with the public gallery. Seeing no one at the public gallery, let's move to room 2040. Seeing no one in room 2040, moderator, please open the lines for people wishing to testify in support of SB 524. Name, organization, position only.
Thank you, Mr. Chair. For comments in support of SB 524, please press 1, then 0. That command again, 1, then 0. And line 111, your mic is open.
Mr. Chair and members, Rand Martin on behalf of the AIDS Healthcare Foundation in strong support of this very necessary bill. Thank you very much.
Thank you. Next line.
Line 112.
Good afternoon, Mr. Chair and members. Pat Whalen, Ellison Wilson Advocacy, here on behalf of United Nurses Association of California, Unions of Healthcare Professionals, in strong support of 524. Thank you.
Thank you. Next line.
Line 100.
Thank you, Mr. Chair, members of the committee. David Gonzalez on behalf of two entities, AFA, Advocating for Access, representing specialty pharmacies at the local level, as well as the California Chronic Care Coalition, both in strong support, and we would thank Senator Skinner for her leadership in this area. Thank you.
Next line. Sorry.
Line 37.
This is Matthew Magner with the National Community Pharmacists Association in support of Senate Bill 524. Thank you.
Okay. Thank you. Next line.
And Mr. Chair, there are no further comments at this time.
Okay, thanks very much. Now let's move to witnesses in opposition. We have two lead witnesses in opposition. So moderator, please bring onto the line Bill Head from the Pharmaceutical Care Management Association and Preston Young for the California Chamber of Commerce. And again, it's 4 minutes total between the two of you. I'll give you a 2-minute warning. So let's start with Bill Head.
Mr. Chairman and members of the committee, my name is Bill Head with Pharmaceutical Care Management Association. We are the National PBM Trade Association. Speaking in opposition to SB 524, I would begin by saying we disagree with the notion that there is patient steering. PBMs simply administer the drug benefit design as developed by the health plan sponsor. PBMs establish pharmacy networks in the same way medical physician networks exist on the medical side. In addition to these networks, PBMs often offer mail order pharmacy services. Because of the size of these mail order pharmacies, they are able to get volume discounts unavailable to brick and mortar pharmacies. These discounts are passed on to the payer and to the patient. But more importantly than the cost savings is the patient quality aspects of mail order pharmacies. Mail order pharmacies have fewer dispensing errors, have higher patient adherence rates, and provide access to a licensed pharmacist 24/7. If a patient has an adverse reaction or a question about a medication they've taken, they can speak to a licensed pharmacist at 3 o'clock in the morning. Because of the savings and quality benefits provided by these services, we strongly urge a no vote on SB 524. Thank you.
Thank you. Now let's move on to Preston Young from the California Chamber of Commerce.
Thank you, Mr. Chair and committee members. Preston Young from the California Chamber of Commerce here today in opposition to SB 524. The overarching concern that we have with SB 524 is that the bill erodes the incentive employers, health plans, and insurers have to design and participate in pharmacy networks. These networks include mail order pharmacies, chain pharmacies, and independent pharmacies, and they help control pharmaceutical costs for patients in addition to healthcare premiums for employers and employees. SB 524 would disrupt this benefit design and the choices plan participants make to reduce pharmaceutical costs, which are substantial. According to the DMHC in 2018, prescription drugs accounted for 12.7% of total health plan premiums. If the number of patients in these networks are reduced and cost-control pharmacy networks offer will be weakened. And unfortunately, while SB 524 is certainly well-intentioned, it will likely act as a healthcare cost driver. For those reasons, we are opposed today. Thank you.
Okay, thank you so much. Now let's move on to additional witnesses in opposition to SB 524. We'll begin with the public gallery. Saying no at the public gallery. Let's move to room 2040. Saying no in room 2040. Moderator, please open the line to witnesses who wish to testify in opposition to SB 524, name, organization, position only.
For comments in opposition to SB 524, please press 1, then 0. That command again, 1, then 0. Line 117, your mic is open.
Mr. Chair and members, John Winger on behalf of America's Health Insurance Plans, also in opposition. Thank you.
Thank you. Next line.
We have a couple more comments coming through. One moment, please, while we provide them with their line number. Line 108, your mic is open.
Thank you, Mr. Chair and members. Nick Luizos on behalf of the California Association of Health Plans in opposition.
Thank you. Next line.
Line 110.
Mr. Chair and members, Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies in opposition.
Thank you. Next line.
Okay, we have no further comments at this time.
Okay, thank you. Let's now move to committee members. Are there questions or comments from committee members? Okay, I know Senator Grove said she had a question. Can we let her know that we're at this period? Senator Wiener, do you have a question?
Well, first of all, I move the bill. I just want to say this is long overdue, and I've experienced this personally, and I know other people who have, that they get, there's a pharmacy where they've always gotten their prescription, and all of a sudden they're told you can't get it there anymore. Sometimes they're told it can only be mailed to you, and sometimes if it's sort of a fragile handling kind of prescription drug, then you have to be home at a certain time to pick it up, and it's very expensive if you lose it, so you can't just have them deliver it somewhere. And it's all for the convenience and benefit of the insurance company and the PBM, and not of the patient. And I think it's very important for people to have the flexibility to be able to get prescriptions where it is convenient for them, because we want people to take their medication in their community from pharmacists who they trust, because people rely on their pharmacists for a lot of reasons. And so this is a long overdue bill, and I move the bill.
Thank you. Bill's moved by Senator Wiener. Are there any questions or comments on the bill? Don't see any. Okay. All right. Well, Senator Skinner, I want to thank you for bringing this bill forward. I think one of the things that I really appreciate is what you're what the bill says is that the health plan can actually even financially incentivize someone to go to a particular source of supply, you know, a mail order or other pharmacy. But what they can't do is they can't say, well, here's our pharmacy network. Oh, by the way, now you're in our plan. You actually can't access the entire pharmacy network. You have to go to a certain place, and you don't even have the option. So I appreciate the opposition saying that, well, maybe mail orders, an opportunity for savings, then fine, give a financial incentives for mail order. But you know, I take care of a lot of patients who are on Medi-Cal, who are lower income. Some do have private plans as well. I realize this probably applies more to private plans, but they may go to a pharmacy where they have a pharmacist who speaks their language, who understands their community, who can provide that kind of not only translation, but also other types of cultural support that makes them more comfortable for getting that. And so I think we need to recognize that patients have different needs as well. And I think certainly you've spoken to some of the challenges of people getting things, whether it's mail order or other sources. But if you're going to say you have a network, let's let people use that whole network, because that's what people are looking for when they sign up for a health plan as well. So with that, I'm supporting your bill, and I appreciate you taking the amendments that then also still give the plans the flexibility to be able to have those incentives. With that, I do know Senator Grove had some questions, but I think unfortunately she's at another committee, and we have to keep moving then. Would you like to close, Senator Skinner?
Thank you very much, Dr. Pan. I appreciate the comments so far made by our committee members. You know, while we know there's not very many independent pharmacies left, and this bill is certainly not designed to only or solely help independent pharmacies, to be in a situation where, for example, you're required to use only a mail order pharmacy, and let's say you need that prescription within an hour or just a few hours, or there could be other circumstances that you're in. And there are other pharmacies in the network that could accommodate you. That just seems like a very unfair circumstance to be in. Now, as I mentioned about independent pharmacies, while again, there's not many left, there are many that still have the type of service where, I mean, just as an example, I grew up in a household that operated an independent pharmacy. My father was a pharmacist. The pharmacy is still operating under his name, independent pharmacy, and it still offers 24-hour service. So there's a pharmacist in this small independent pharmacy who has a phone in their home, and a patient can then call if it is an emergency where they need a prescription, and it will be filled on the spot and delivered to them. So again, while that's not a service that many pharmacies offer, to be in a situation where we have prescription benefit managers basically preventing you from utilizing such a service if that's what your preference is, and that pharmacies in the network just seems wrong. And I also find it interesting that the chamber would certainly, some of these larger operations are members of the chamber, but I like to think of the chamber as representing all business interests instead of only a select few. And this, to my terms, is a business-friendly bill because it levels the playing field for businesses and doesn't just give one an unfair advantage over another. And as was pointed out by both the chair and my main witness, this still allows for the health plan or the benefit manager to be able to give a discount and incentivize someone to use it, which of course then the patient can choose to get that discount. But all that it does is prohibit them from requiring the patient only to use one particular. And with that, I ask for your aye vote.
Okay. Thank you, Senator Skinner. All right, with that, I understand, let's see, Senator Wiener, you moved the bill, correct? So the bill's been moved by Senator Wiener. The motion is do pass as amended, but first amend and re-refer to the Committee on Appropriations. Consultant, please call the roll.
Pan.
Aye.
Pan, aye. Melendez. Eggman.
Aye.
Eggman, aye. Gonzalez.
Aye.
Gonzalez, aye. Grove. Hurtado. Leyva.
Aye.
Leyva, aye. Limon.
Senator Limon, SB 524I.
Limon, aye. Roth.
Aye.
Roth, aye. Rubio. Wiener.
Aye.
Wiener, aye.
Okay. Bill is currently 7-0. Put the bill on call. Thank you,
Great,
Senator
thank you
Skinner.
so much.
All right. Next item is item number 8, SB 637 by Senator Newman. Welcome.
And I'm Melinda.
Thank you, Mr. Chair. Mr. Chair and members, good afternoon. I'm here before you today to ask for your support for Senate Bill 637. Before I begin, I'd like to thank both the chair and committee staff for their thoughtful engagement and the many suggestions which led to the amendments to the bill as originally drafted. SB 637 seeks to ensure that hospitals are transparent about their staffing resources to enable our nurses on the front lines to prepare and plan so that they can protect themselves as much as possible from unnecessary risk of illness while providing life-saving care to their patients in a safe environment. This bill does two things. It requires hospitals to report nurse staffing shortage data and staff COVID testing data to the State Department of Public Health on a weekly basis during a health-related state of emergency and on a monthly basis at all other times, sunsetting 5 years from now. CDPH would then be required to publicly post this information accordingly. It directs hospitals to publicly post notices of emergency health and safety waivers, including those relating to nurse-to-patient ratios, directly adjacent to their licenses on their premises. Notably, the COVID-specific reporting requirements in the bill contain a sunset of January 2025 to acknowledge that even with vaccines, the virus will likely continue to be present much in the same way as the annual flu is now. Nurses and hospital staffs will risk exposure, so it is important for hospitals to be transparent about the number of COVID cases among staff at any given time. Fortunately, hospitals are no longer experiencing the unprecedented surges that persisted earlier in the pandemic, and the expedited waivers of nurse-to-patient ratios that were granted to hospitals have since ended. Despite these positive trends, hospital staffing issues remain a serious concern, along with the burdens and risks that can entail to staff. The data reporting in this bill will ensure nurse-to-patient ratios remain manageable for the safety and welfare of patients, nurses, and other critical staff. In addition, the posting of waivers will ensure healthcare